I think a good framework for us, at least to start, is to look at the myths surrounding iodine and bust them. Are you with me?
I'm with you.
Okay, first one is that too much iodine causes Hashimoto's. Take that and run.
There are some loud practitioners on the internet making that claim, and they've been making that claim for years. It's interesting, they're making that claim over these years that iodine levels have been falling across the United States, according to the National Health and Nutrition Examination Survey. And over the last 50 years, iodine levels have fallen over 50%. During that same time, autoimmune thyroid diseases have skyrocketed epidemically. So really, we could end our discussion here because that's an inverse correlation. That's a negative correlation. And that rules out iodine as the cause of the autoimmune thyroid epidemic that we're having. So um, if you look back in the literature, it's pretty clear that iodine deficiency sets up the thyroid for autoimmune thyroid disease. But as far as iodine causing the epidemic of autoimmune thyroid disease, that's proven false. Anyone who still says it is spreading misinformation, and it's just not true.
Okay, slight pivot. Somebody that has Hashimoto's should avoid iodine.
So, I write about this in my iodine book, and in my first 10 years of when I went to medical school and residency, I went to be a family doctor. I didn't go to be an alternative medicine doctor or a holistic doctor, however you want to refer to me as. I bought into everything I was taught, hook, line, and sinker. I was straight as an arrow, and I never deviated from what I was taught. And so when I started practicing conventional medicine, I lasted about 6 months before I realized just isn't for me. I'm not making my patients better. I'm not making myself better, and I'm not helping my patients. I'm just prescribing drugs to treat the side effects or treat the symptoms of illnesses, and more drugs to treat the problems of the first drugs. So then, I think we talked about it in my last interview with you, and I get into it more if you want me to. But my dad was my first patient, and he had bad heart disease, and he was on 12 medications to control cholesterol and hypertension and diabetes. And simply by getting him on a couple of bioidentical hormones, particularly thyroid hormone and testosterone, his 30-year history of heart disease, got significantly better. His 20-year history of continual angina went away within 7 days. His cholesterol in the 300s fell below 200 without changing any of his bad habits. And I decided, hey, I'm going to do holistic medicine, whatever that was, because I didn't really know at that time. But what I knew was my dad got better from 2 bioidentical hormones. And I started with thyroid hormone and testosterone. So I really started focusing on every single patient from that moment on, including up until 35 years later now. Everyone gets a hormonal evaluation. Everyone gets a thyroid hormone evaluation. And so I started diagnosing a lot of hypothyroidism and autoimmune thyroid disease at the time. And a lot of it was hypothyroid. And I was putting people on thyroid hormone. Now, I didn't know about iodine at that time. And I was using solely thyroid hormone to correct hypothyroidism, and trying nutrients to see if they would work for it. And I would try various nutrients. I was drawing a lot of blood tests, checking a lot of nutrient levels. And I was trying magnesium, selenium, vitamin C, whatever they were deficient in or whatever they were lacking. And nothing worked like thyroid hormone to get hypothyroid patients feeling better. And I was also trying iodine at that time. Now, I didn't know a lot about iodine the first 10 years of my clinical practice. And iodine, for me, was a difficult item to study. It's got all these different isomers, and there's iodide, there's iodine, there's iodate, and you didn't learn about it in medical school. No one ever talked about it. In medical school, the only thing I learned about iodine was that iodine deficiency was a thing of the past, and iodine salt corrected that, and no one's iodine deficient anymore. That's what I learned in medical school. Even though when I was in medical school, the studies were coming out from the National Health and Nutrition Examination Survey that the vast majority of Americans were deficient in iodine. But anyways, that's what I learned. So I wasn't using iodine, and I would try iodine in the first 10 years of my holistic practice, little amounts, medium amounts, and large amounts, and it wasn't helping patients like thyroid hormone was helping. And during that first 10 years of my practice, 2 studies came out by a researcher from the East Coast, Eskin. And the first study looked at women who were on thyroid hormone for women who took thyroid hormone versus women who didn't take thyroid hormone. And the women who took thyroid hormone had I don't have the numbers exactly in my head, 25, 30% increased risk of breast cancer if you took thyroid hormone versus women who didn't take thyroid hormone. The second study done by the same group found the longer you took thyroid hormone, the more breast cancer there was in the thyroid hormone group. So the women who took thyroid hormone for at least 10 years had a 50% increased risk of breast cancer versus women who never took thyroid hormone. Now, I was clearly taught in medical school that hypothyroidism is associated with different cancers, including breast cancer. Um, there was a lot of research pointing that direction that, hypothyroid state can lead to abnormal growth of tissue in the glandular tissue, including the breast. And so here was a researcher publishing a couple of articles saying, hey, if you put women on thyroid hormone, their breast cancer risk goes up. And if they're on it for at least 10 years, it goes up significantly, 50% higher. Now, in the US, we have 1 in 7 women with breast cancer, a lifetime risk of breast cancer. I mean, 1 in 7. Think about all the women in your life. That's a lot of women, that, have this risk out there. And I certainly don't want to do anything to increase that risk. But I looked at those studies in the first 10 years, and I'm pretty good at reading research, pretty good with statistics, thought they were decent studies, and I didn't know what to do with them, and I filed them away, and they bugged me. And I kept coming back to them, and I kept reading them, and they continued to bug me. And then around year 10 of this holistic practice, a doctor writes a letter to one of the journals that I get saying he develops an iodine loading test. His name was Dr. Guy Abraham. He became my mentor in iodine. He became a dear friend of mine and a colleague. And I saw the article and I thought, wow, iodine has failed me over and over. There wasn't a great test at that time that I could use to look at iodine levels in the human body. I called him up. Dr. Abraham was a tough guy to talk to till he gets to know you. I took a lot of abuse in the first few phone calls. He was very leery of other doctors stealing his information or even misusing his information. And so I kept on and because I wanted to know about this test. And then he started sending me articles that he had written, and I went through his articles, and all of a sudden I started reading about iodine and breast disease. And I didn't really know about it up until then. And the relationship between iodine and breast disease was been written about for at that time. That was 1990s, 50 years. And there's a lot of research with iodine and fibrocystic breast disease as the treatment of choice for it. We now know fibrocystic breast disease is a precursor to breast cancer that's affecting 1 in 7 women across the United States. And there's a lot of articles on iodine and breast cancer in animals, test tube, and human studies. So Dr. Abraham taught me why the form of iodine I was using wasn't working in my patients. And when I started using the right form of iodine, I started to have the great results that I'm still getting today. And as soon as I saw the relationship with iodine in the breast, I immediately went back to the Eskin articles. And it's like the old V8 commercials, for those of us old enough to remember them. I hit myself in the head. I'm like, it's the iodine, stupid. That's the relationship between why women who took thyroid hormone had an increased risk of breast cancer versus women who didn't. Why women who took thyroid hormone for at least 10 years had a 50% increased risk of breast cancer versus women who didn't. Because when you give someone thyroid hormone who's hypothyroid, if they're iodine deficient, you're going to increase the metabolic needs of the body, which increase iodine needs of the body. If they're iodine deficient, giving that thyroid hormone is going to make the iodine deficiency worse. And the consequences of that are glandular problems. Problems include the glands include thyroid, ovaries, uterus, breast, prostate, and pancreas. What are we seeing today? Third time I'll mention it. 1 in 7 women with a lifetime risk of breast cancer in the United States. Fastest growing cancer in the United States is thyroid cancer. We all know people with pancreatic cancer. Pancreatic cancer used to be relatively uncommon when I was young and in my training years. Now you're seeing pancreatic cancer in young people. Ovaries, uterus, prostate. Men have a 1 in 3 risk of prostate cancer if they live to above the age of 70. I say all these problems can be due to iodine deficiency. So back to your original question, if they have Hashimoto's disease, since Hashimoto's disease, in what I read about in my book and with studying the literature, Hashimoto's disease and Graves' disease is due to iodine deficiency in the vast majority of people. The treatment for it is iodine as part of a holistic treatment regimen. Now, the only caveat to that is if somebody has an autonomously functioning thyroid nodule, that's a small nodule that's lost control. The thyroid has lost control. The body's lost control of it. It's on its own. It's sitting in the thyroid gland somewhere, which is in the lower part of the neck here. And if you give iodine to those people, that nodule can stoke it up, make a lot of thyroid hormone, and make people hyperthyroid. They don't like that. Now, in 30 years of doing this, give or take, I've got a handful of people who have this problem. I mean, it's not this many hands. It's less than this. And my partners occasionally will run across it. It's not many, but it's out there. That's the real risk of doing it. Otherwise, I've treated many patients with Hashimoto's disease with iodine. My two daughters, being an N of two, they were diagnosed by their mother because their father was too busy and not paying attention. And she's like, "Hey, you think they got a thyroid problem?" And so they both had Hashimoto's disease. When I lecture to doctors, I show the sequence of testing with them as I put them on iodine and watch their autoimmune thyroid titers, TPO and thyroglobulin antibodies go down. So if the hypothesis is that Hashimoto's is caused by iodine, whether you're going to say iodine excess or just iodine, period. Well, my N of two can disprove that hypothesis because a hypothesis has to withstand all criticisms. If there's one failure shown in this hypothesis, the hypothesis has to be reworked. But that hypothesis doesn't have to be reworked. It's just not true. So that's a long answer to maybe a quick question. Maybe it's too long.
Somebody that has Hashimoto's and they're going to start supplementing with iodine, is that protocol different than somebody tuning in today that's healthy that's going to start including iodine?
Well, look, everyone is a unique biochemical individual and should be treated as such. So I think everyone needs individual treatment. So yeah, I mean, they're different people. Can a Hashimoto's patient take iodine? Yes, as long as they don't have an autonomously functioning nodule, and a good clinician can work with you and differentiate that and, help you through that. So in my practice, we've tested over 8,000 people for our iodine levels. Over 97 is 98, just right below 98% are iodine deficient. The vast majority are severely iodine deficient. And the only people that aren't iodine deficient are the ones that have read my book, seen my lectures or something like that, and are taking iodine on their own. Everyone else seems to be iodine deficient. When I talk to my colleagues around the country and they do the testing, they're seeing the same thing that I'm seeing.
The reason I zoned in there with Hashimoto's and the protocol, I was just wondering if they had to take it slower. And then also on top of that, a lot of times if they've been diagnosed and they've seen a conventional doctor, they're going to be on thyroid meds. How does the medication change as they begin a protocol like we're talking about?
The answer to the first part of your question is that do I take it slower with people with Hashimoto's versus people without Hashimoto's? The answer is no. As long as they don't have an autonomously functioning nodule, I treat them the same. And I find the vast majority of them, their autoimmune titers go down. Many of them, they become not Hashimoto's disease after a period of time with taking iodine. The answer to your second part of your question, for someone who's already on thyroid hormone, how do you do iodine? Well, recall the first 10 years of my practice, I was treating people with thyroid hormone without iodine. During that time period, my average dose of thyroid hormone was about 2 grains, 120 milligrams. Once I started adding iodine in, and now I'm 25 years later, my average dose of thyroid hormone now in people is about 30 milligrams, 30 to 60 milligrams. So I'm down by, twofold to fourfold thyroid hormone for what I needed before versus using iodine now. So when I put people on iodine who are already on thyroid hormone, I tell them the rule of thirds comes into play. 1/3 of these patients on thyroid hormone are going to find they didn't need thyroid hormone, they just needed iodine. 1/3 are going to find they need half the dose of thyroid hormone, and 1/3 are going to find they need the same dose of thyroid hormone. And when they take iodine, the entire group generally feels better and more energy and better brain function and more stability and just more, joie de vivre. Um, so um, it's interesting that I am now using much less thyroid hormone than I was, 20 years ago, 25 years ago in my practice. And that is really solely because of iodine.
And when you do use it, you mentioned the dosages. What type do you use?
So before the first 10 years of my practice, you know, I wrote a book called Overcoming Thyroid Disorders, and I write about this in my book. The first 10 years of my practice, I was pretty adamant that natural desiccated thyroid hormone from a porcine-derived source was the better source of thyroid hormone for people that needed thyroid hormone. It more closely mimicked human thyroid hormones, and people responded to that better than synthetic thyroid hormones like T4 derivatives only. Now that I'm using iodine, I'm not so stuck on that. What I find is that if people have enough iodine levels, if they get their iodine levels situated before they go on thyroid hormone, it generally doesn't matter what form of thyroid hormone they use. They'll respond to all of it pretty much equally. Having said all that, I do think the natural desiccated thyroid hormone is a little bit of a better choice for most people.
And when it comes to T4, T3, the number there at the end is actually the amount of iodine in that molecule. So my question is, when somebody's supplementing while actually taking a medication, does that already have the iodine part of that molecule? Or do we need iodine from the body to finish building that?
Perfect question. So thyroxine is T4. The 4, as you just said, refers to 4 atoms of iodine attached to the thyroxine molecule. And T3 is 3 iodine atoms attached to the triiodothyronine molecule, T3. So let me rephrase your question. Maybe your question could have stated, do people need to take iodine if they're taking thyroid hormone because there's iodine attached to the thyroid hormone? That iodine in that thyroid hormone is used for the thyroid gland and for thyroid purposes. There's not enough iodine in thyroid medication to supply adequate amounts for the breast, the ovaries, uterus, pancreas, prostate, skin, hair, nails, every tissue, every cell in the body, every tissue in the body needs iodine. The highest concentration of iodine is in the fat cells. Next highest concentrations in the muscles. The thyroid gland at saturation contains 50 milligrams of iodine. When you're taking thyroid medication, it's micrograms. It's tiny amounts of iodine. It's not enough for the whole body effective iodine.
Well, the reason I was so curious is tying back to what you're talking about before, the connection between taking thyroid hormone and cancer.
The easy way to think about that is when you take thyroid hormone, you increase the metabolic needs of the body. The metabolic machinery in every cell speeds up when you take thyroid hormone. So the consequence of this metabolic machinery speeding up is you produce heat. People are warmer. Their hands and feet and face and nose and stuff are warmer. In contrast with hypothyroid, where there's not enough thyroid hormone, the metabolic machinery is running at a very slow rate. They're cold. And that's a cardinal sign of hypothyroidism. They have cold hands, cold feet, cold nose, cold butt, because they're not producing enough heat to warm their body. So when you go on thyroid hormone, you increase the metabolic needs of the body. Those metabolic needs have to be met with iodine, part of it. And iodine helps the adrenals make adrenal hormone, helps the ovaries make ovarian hormones, helps the testicles make testicular hormones. If you increase those metabolic needs, problems are going to develop. And that's where Dr. Eskin studies found this increased risk of breast cancer in, women supplement with thyroid hormone versus women who didn't take thyroid hormone. I mean, I remember looking at those studies for years thinking, man, these are bugging me. I think I'm doing something good by diagnosing and treating hypothyroidism, but yet am I going to cause 1 in 7 women or more to have, breast cancer problems? And then, I was lucky to come to a conclusion that I thought was valid and that makes sense to me. And certainly I've told you I can see after 25 years, it's made sense to my patients.
So when we talked about somebody with Hashimoto's versus a healthy patient starting to take iodine, you were clear that the protocol is the same. Talk about dosage wise, and then specifically somebody with Hashimoto's, how quickly will things start changing in the body?
So with Hashimoto's disease, it's not just treat with iodine, see you later. It's checking vitamin levels, mineral levels, other hormone levels, toxification levels, and, cleaning up the diet, drinking water, exercise. Look, it's a part of a holistic treatment regimen. So it's not just taking iodine. So my average dose for starting someone on iodine for an adult is 25 milligrams. Um, if they have cancer of the glandular tissue, thyroid, ovaries, uterus, breast, prostate, or pancreas, I'll use more, and I'll quickly use more. If they have glandular disease, I will use more and quickly use more. Um, and I've cancer patients taking hundreds of milligrams of iodine. Um, and I follow levels. I follow levels of their other hormones and their thyroid hormones, and I see people back and clinically evaluate them. I mean, I have 6 partners. We all do this. We all do virtually the same thing in relation to that. Um, the second part of your question was how quickly do the antibody levels come down? My kids, when I show the sequence of events, my kids were diagnosed by their wife. So we're having dinner one day. Kids are about 11 and 12 years old, and 2 girls. They're playing soccer. They're getting good grades. Everything's fine. They're complaining of being tired, having headaches. And I kept telling Allison, other teenagers, this is what teenagers do. And we're having dinner, and she says to me, "Do you think they have a thyroid problem?" Because both Allison and I have thyroid problems. I look up, and I remember I had a fork or a spoon near my mouth, and I'm like, I stop, and I my other hand on my head. I'm like, oh yeah, it's like the shoemaker's kids with no shoes. So I draw their levels, and they both have raging Hashimoto's disease and hypothyroidism. So, not raging hypothyroid. They had small, tiny bits of hypothyroidism, but a lot of antibodies. Both Haley and Jesse had antibodies of 700 and higher. Their thyroglobulin and TPO antibodies. So I put them both on iodine, and then I track their levels to come down. Haley was 12 years old. By 16 or 17 years old, her levels steadily came down to 0. Jesse's took a little bit longer, maybe 18, 19 years old. Neither of them have signs of Hashimoto's right now. Hashimoto's disease makes pregnancy a little bit more difficult to get. Haley had a baby. Jesse's pregnant right now. They feel better. Their headaches went away. Their fatigue went away. I put them both on iodine. Now, they were kids. They were 11 and 12, weighing under 100 pounds. I put them on 12.5 milligrams to start. I quickly raised them up, even when they were that little, to 25 and 50 milligrams. As their levels kind of stalled after a bit on 12.5, I bumped them to 25. And then eventually they both went on 50 to 75 milligrams. And currently this N of 2 has no signs of Hashimoto's disease.
You quickly went over general practices that you'd recommend somebody take on with iodine. And I actually had written down for my next question, adjuncts as somebody takes iodine. So in a more specific sense, I've heard things like selenium are an important thing to take when you're upping your iodine. What adjunct supplements do you recommend to people?
So iodine should be used as part of a holistic treatment regimen, and that includes a comprehensive evaluation of nutrition, toxification items, other hormone levels. So selenium's important. I don't use a lot of selenium because I live in an area of the world or the United States where selenium is not deficient in the soil and water. I don't find a lot of selenium deficiency in my patients. Now I use it. I find more B vitamin deficiencies. I live in Michigan, the winningest college football team in the history of college football, and the should be the number 1 team in basketball right now. But we're in northern climate, and vitamin D deficiency is rampant. Thiamine deficiency is rampant. Vitamin B1. Riboflavin deficiency is fairly common. What else? Vitamin A deficiency. So these are magnesium. All these things are checked, including selenium. And we do a comprehensive evaluation, and I see people back every 6 months, give or take, and keep checking in these things and keep optimizing things. So Yeah, selenium's important, but it's no more important than vitamin A. It's no more important than magnesium or thiamine or B12 or vitamin D, which I find deficient in, vast numbers of patients. Much more deficient than selenium.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
Over the last 50 years, iodine levels have fallen over 50%. We've tested over 8,000 people for our iodine levels, just right below 98% are iodine deficient. The vast majority are severely iodine deficient. In our toxic world, with our exposure.